Hello everyone, it's time for another warm-up. Let's get going. First question here, which hormones stimulate pancreatic secretions? First we have acetylcholine, that's going to be via the vagus nerve. We have cholecystokinin, and then we have secretin, and that's going to stimulate the pancreatic duct cells to generate a lot of bicarb secretions. Next, what are the equations for odd ratio, relative risk, attributable risk, and number needed to treat? So odds ratio is going to be A over B divided by C over D. Or you can say AD divided by BC. Or then again, another way of writing the same thing is going to be A over C divided by B over D. Next, we have relative risk. That's going to be A over A plus B divided by C over C plus D. Attributable risk, A over A plus B minus C over C plus D. And then the number needed to treat is 1 over the absolute risk reduction. All right, guys, that brings us to the end of the warm-up. Let's get to that lecture now.
In this video, we're going to discuss disease prevention and public health. Now, we talk about disease prevention throughout the course, but I want to focus specifically on some topics that we don't cover elsewhere. Let's start by talking about different types of prevention. Primary prevention is prevention of a disease from occurring in the first place. Examples would include vaccination or encouraging condom use to decrease the risk of HIV transmission. So primary prevention is where you do something to prevent a healthy person from developing disease. Now, secondary prevention is early detection of disease to prevent disease progression. Think about breast cancer screening with mammograms. Mammograms don't actually prevent breast cancer, but they do allow you to detect it at an early stage in order to prevent progression and morbidity. Tertiary prevention is measures to reduce disability from a disease. So the patient already has the disease, but we're trying to keep the patient as healthy as possible and avoid any disability. An example would be prescribing prophylactic antibiotics for AIDS patients, like TMP-SMX to prevent PCP. That TMP-SMX doesn't actually prevent the HIV from progressing, but it can help limit the overall burden of disease by preventing PCP. And then quaternary prevention is sort of a new name for an old concept. It's the idea that patients can be harmed by overdiagnosis and overtreatment. For instance, if you give a patient an unnecessary antibiotic for a viral infection, not that you would ever do that, but say some quack doctor from that other medical school treated a URI with an antibiotic, and then the patient had some serious reaction to the unnecessary antibiotic. Or you could cause patients undue stress by ordering too many tests, and that stress is harmful to the health. So quaternary prevention is the judicious and evidence-based use of medical interventions in order to avoid unnecessary risks to patients. Basically, keep patients out of the healthcare system unless they need it. We mentioned vaccination as a form of primary prevention. For step one, you need to be familiar with the various vaccines that are available and what diseases they prevent. And you need to be somewhat familiar with when these vaccines are given. Now, you don't need to memorize the specific vaccine schedules, but you should be generally familiar with which type of patient gets which vaccine. But you do need to know the diseases that are vaccine preventable. For most vaccines, it's pretty straightforward. It's just the vaccine name itself. But some of these are potentially tricky. So let's start with the table of routine vaccines for childhood in the study guide. The rotavirus vaccine prevents rotavirus, which is a severe diarrheal illness in infants and young children. The diphtheria, tetanus, and pertussis vaccines are a little more confusing because there are several different combinations that we give to different groups, and the names of all of them are kind of similar. These vaccines prevent diphtheria, tetanus, which is caused by Clostridium tetani, which is also called lockjaw, and then pertussis, which is commonly called whooping cough. So the first two vaccine combinations are the DTaP, diphtheria, tetanus, and acellular pertussis, and the DT, or diphtheria and tetanus. So these are given to infants and children under the age of 7. You generally use DTaP, but the DT vaccine is for children who can't tolerate the pertussis component. Next you have the Tdap, which is tetanus, diphtheria, and acellular pertussis, and the TD, which is just tetanus and diphtheria. So the lowercase d and p indicate a lower dose of the diphtheria or pertussis component of these vaccinations. Lowercase a just stands for acellular and acellular pertussis. The Tdap is given as a booster shot in adolescents, unless pertussis is contraindicated, in which case you just give the TD. And this is what you use for the tetanus booster shot every 10 years, or whenever you step on a nail or whatever. The next vaccine is Haemophilus influenza type B, often called HIB or HIB or H-flu. So this is where the diseases prevented gets a little trickier, because H-flu can cause meningitis, epiglottitis, osteomyelitis, pneumonia, bacteremia, and septic arthritis. So on your exam, they might give you a patient with epiglottitis, which they love to test, and then they ask you which of the following vaccines would have prevented this disease. So you have to know the presentation of epiglottitis, and then remember that epiglottitis is often caused by Haemophilus influenza. Next is the pneumococcal vaccine. There are two different variations. There's the pneumococcal conjugate vaccine, or PCV13, which covers 13 different pneumococcal serotypes. So this is given to infants and toddlers. Then there's also a pneumococcal polysaccharide vaccine, or PPSV23, that covers 23 pneumococcal serotypes. Now this is given to adults 65 and older, but there are certain instances where children over the age of 2 can receive the PPSV23 vaccine, such as kids with chronic heart disease or lung disease like asthma, or kids with diabetes, or asplenic kids like sickle cell patients, or immunocompromised kids, including kids with HIV. So some kids will receive both pneumococcal vaccines. They receive the routine conjugate vaccine, PCV13, as an infant, and then they receive the polysaccharide vaccine a few years later if they develop asthma or one of these other conditions. Now, both of these vaccinations prevent infections due to Streptococcus pneumoniae, such as otitis media, sinusitis, pneumonia, bacteremia, and meningitis. We sometimes informally call this the pneumonia vaccine, but it really only prevents pneumonia from Strep pneumoniae, and only those specific serotypes of Strep pneumo. The meningococcal vaccine is usually given to adolescents, 11 or 12 years old, with another booster at 16. But it can be given to younger kids as old as 2 months if certain risk factors are present. The meningococcal vaccine prevents Neisseria meningitidis infection, including meningococcal meningitis, pneumonia, and septic arthritis. Next is the inactivated poliovirus vaccine, or IPV, which is given to infants to prevent polio. Now, the polio vaccine used to be a live attenuated or weakened virus vaccine that was administered orally. And that can rarely cause actual polio, so that's been replaced by the inactivated polio vaccine here in the U.S. The influenza vaccine is recommended both for children 6 months and older and also for adults. And this is given once a year. This prevents seasonal influenza. The predominant strains of influenza virus that circulate and cause disease change every year, which is why we have to get a flu shot annually. But the flu shot contains either inactivated virus or recombinant viral proteins. Then there's also a flu vaccine that's a live attenuated virus. And that's given as a nasal spray, which is great for people who are scared of needles. The MMR vaccine prevents measles or rubeola, and then mumps and rubella. The varicella vaccine prevents varicella, which is chickenpox. Hepatitis A vaccine prevents acute hepatitis A, and the hepatitis B vaccine prevents acute hepatitis B. And therefore, it also prevents chronic hepatitis B, which can lead to things like cirrhosis and hepatocellular carcinoma. The last one is the HPV vaccine, or human papillomavirus. So there's one vaccine that covers 2 HPV serotypes, serotypes 16 and 18, and there's another vaccine that covers 4 serotypes, serotypes 6, 11, 16, and 18. So this not only prevents genital warts from HPV, but also cervical cancer, other genital cancers, and anal cancer. And while HPV can also cause oral cancer, we don't have good studies yet to prove that the HPV vaccine specifically prevents oral cancer. Now, what about vaccinations for adults? We've mentioned most of these vaccines already, but it's important to know which routine vaccines are specifically recommended for adults. We give a tetanus and diphtheria booster shot every 10 years throughout a person's life. And since there's been a resurgence of pertussis, it's recommended that the Tdap should be given once in place of the regular TD booster in adults. The pneumococcal polysaccharide vaccine, PPSV23, is given once at 65 years or older. And it could also be given to younger individuals who have certain high-risk chronic medical conditions, things like diabetes, liver disease or lung or heart disease, smokers, asplenic patients, HIV patients, other patients with immunocompromised states, and also patients with CSF leaks. The pneumococcal conjugate vaccine, PCV13, is also recommended for everyone over the age of 65 if they haven't already been vaccinated with PCV13. So we don't give both PCV13 and PPSV23 at the same time. We separate them by a little bit. Influenza vaccine is recommended annually for adults. HPV is recommended for young women and men if they were not vaccinated as adolescents. So if they were vaccinated as adolescents, you don't have to give it to them as an adult. You might also need to do catch-up vaccines with MMR and varicella if a person's never had the disease or had the vaccine. And then finally, the herpes zoster or shingles vaccine is indicated in all patients over the age of 60. So we basically assume that patients in this age group have already had chickenpox as a child, which means they're all at risk for shingles. And we give this vaccine even if they've already had shingles. There are certain diseases that should be reported to government health authorities. Now, this isn't very high yield, but some students have seen questions on reportable diseases on their exam. So the CDC publishes a list of reportable diseases annually, but then the states actually collect the data and then submit it voluntarily to the CDC. So there are basically 5 different categories of reportable diseases, and you might be surprised by some of them. Sexually transmitted infections is one, including things like HIV, chlamydia, gonorrhea, and syphilis. Viral hepatitis, specifically hepatitis A, B, and C. Other vaccine-preventable infections like measles, mumps, rubella, diphtheria, and pertussis all need to be reported. Diarrheal illnesses, specifically salmonella and shigella. And then finally, tuberculosis. Another type of prevention includes prevention of injuries, especially in terms of preventing injuries in automobile accidents. Now, seatbelt laws and car seat laws are tough to test because those are state laws, not nationwide laws. But car seat guidelines do show up on step 1. We've listed them for you in your study guide. Kids under 2 should be in a rear-facing car seat, preferably in the middle of the back seat. You don't put kids in the front seat. Then from ages 2 to 4, you move them to a forward-facing car seat with a chest harness, basically until they outgrow that seat. And then they're going to be in a booster seat with the seatbelt on, still in the back seat, until they're 4 foot 9 inches tall. So it's not an age requirement, it's a size requirement specific to the car seat. And then once they outgrow that, they should still use seatbelts, and they should stay in the back seat until age 13. Now we're ready for the end of session quiz. So pause the video, answer those questions, then we'll go through the answers together. First question, what's the current recommendation for the meningococcal vaccine? So without getting into too much detail, the main recommendation is all children should be vaccinated at 11 to 12 years of age and then have a booster at age 16. But in certain rare, high-risk conditions, we sometimes give this vaccine to kids as young as 2 months old. But for most kids, this is a preteen vaccine. Next, which adult patient population should receive the pneumococcal vaccine, PPSV23? So all patients over 65 should receive the vaccine, plus patients younger than 65 should be vaccinated if they're members of certain high-risk groups, such as patients with chronic heart, lung, liver, or kidney disease, patients with diabetes, smokers, alcoholics, patients with CSF leaks, patients with asplenia, including sickle cell patients, and then immunocompromised patients, including those with HIV or congenital immunodeficiency states, or even leukemia or lymphoma. Again, don't memorize this list, but be familiar with the general idea. Everybody over 65 plus chronically ill people under 65. Next, which diarrheal illnesses are reportable diseases? That's going to be salmonellosis and shigellosis. And finally, which vaccines should prevent each of the following diseases? Now, some of these are pretty obvious. Seasonal influenza is the annual influenza vaccine. Hepatitis A is a hepatitis A vaccine. Hepatitis B is a hepatitis B vaccine. Hepatitis C is a trick question. There's no vaccine for hepatitis C. Some types of anal cancer can be prevented by the HPV vaccine. Genital warts is also the HPV vaccine, since most genital warts are caused by HPV type 6 and 11. So this would be an indication for the quadrivalent vaccine, which covers serotypes 6, 11, 16, and 18, rather than the bivalent vaccine, which only prevents serotypes 16 and 18. Neisseria meningitidis sepsis is prevented by the meningococcal vaccine. Epiglottitis is prevented by the HIB, or Haemophilus influenza type B vaccine. Whooping cough is the Tdap and DTaP vaccines, the pertussis-containing vaccines. Septic arthritis could be prevented by both H-flu and meningococcal vaccines. Clostridium tetani would be TD, DT, Tdap, or DTaP, any one of those tetanus-containing vaccines. Clostridium botulinum, there's no vaccine for that one. Cervical cancer can be prevented by the HPV vaccine. Shingles is prevented by the zoster vaccine. Rubeola is another name for measles, so the MMR vaccine will prevent that. And then lockjaw is another name for tetanus, so you can prevent that with TD, DT, Tdap, or DTaP. And that's it for now. I'll see you next time.